Mental Health ADHD Quiz Questions. Question 1. In the treatment of a patient with obsessive-compulsive disorder (OCD), using cognitive behavioral therapy (CBT), which specific type of CBT is most effective? Option A. Dialectical behavior therapy. Option B. Exposure and response prevention. Option C. Interpersonal therapy. Option D. Supportive therapy. The correct answer is option B. Exposure and response prevention. Exposure and response prevention (ERP) is a specific type of CBT that is considered the most effective treatment for OCD. ERP involves exposing the individual to anxiety-provoking stimuli and preventing the usual. Question 2. A patient with generalized anxiety disorder (GAD) is prescribed buspirone. The nurse understands that buspirone is different from benzodiazepines because it: Option A. Has a high potential for abuse. Option B. Works immediately to relieve anxiety. Option C. Does not cause sedation. Option D. Is used for short-term treatment only. The correct answer is option C. Does not cause sedation. Buspirone is different from benzodiazepines because it does not cause sedation. Unlike benzodiazepines, buspirone has a lower potential for abuse and does not cause the sedative effects commonly seen with. Question 3. Which characteristic presents the greatest risk for injury to others in a patient diagnosed with schizophrenia? Option A. Depersonalization. Option B. Pressured speech. Option C. Negative symptoms. Option D. Paranoia. The correct answer is option D. Paranoia. Paranoia in patients with schizophrenia can lead to aggressive behaviors, including violence, which poses a significant risk of injury to others. Individuals experiencing paranoia may perceive others as threats and. Question 4. Tomasz is a 21-year-old male with a recent diagnosis of schizophrenia. Tomasz's nurse recognizes that self-medicating with excessive alcohol is common in this disease and can co-occur along with Option A. Generally good health despite the mental illness. Option B. An aversion to drinking fluids. Option C. Anxiety and depression. Option D. The ability to express his needs. The correct answer is option C. Anxiety and depression. Individuals with schizophrenia often turn to excessive alcohol consumption as a way to manage symptoms of anxiety and depression. This maladaptive coping mechanism can exacerbate the challenges associated with. Question 5. A healthcare provider is providing care for a patient with schizophrenia. Which symptom would be considered a positive symptom of this disorder? Option A. Eulogia. Option B. Andonia. Option C. Delusions. Option D. Flat affect. The correct answer is option C. Delusions. Delusions are considered a positive symptom of schizophrenia. Positive symptoms represent an excess or distortion of normal functions, such as hallucinations, delusions, or disorganized speech or behavior. N. Question 6. Natasha's husband died suddenly 2 months ago, and she has been overwhelmed with grief. When Natasha is subsequently diagnosed with major depressive disorder, her daughter, Nadia, makes which true statement? Option A. Depression often begins after a major loss. Losing dad was a major loss. Option B. Bereavement and depression are the same problem. Option C. Mourning is pathological and not normal behavior. Option D. Antidepressant medications will not help this type of depression. The correct answer is option A. Depression often begins after a major loss. Losing dad was a major loss. When individuals experience a significant loss, such as the death of a loved one, it can trigger major depressive disorder. This is because the intense grief and sadness associated with the loss can lead to the. Question 7. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A. Encourage the patient to ignore the voices. Option B. Provide a structured and safe environment. Option C. Engage the patient in a debate about the reality of the voices. Option D. Ask the patient to describe the content of the hallucinations. The correct answer is option D. Ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess. Question 8. Which of the following is a common side effect of electroconvulsive therapy (ECT)? Option A. Memory loss. Option B. Weight gain. Option C. Insomnia. Option D. Increased appetite. The correct answer is option A. Memory loss. Memory loss, particularly short-term memory loss, is a common side effect of electroconvulsive therapy (ECT). ECT can affect memory due to its impact on brain function during and after treatment, while the memory. Question 9. A patient with post-traumatic stress disorder, PTSD, is experiencing flashbacks. The most appropriate intervention is to: Option A. Encourage the patient to talk about the trauma. Option B. Help the patient reorient to the present. Option C. Leave the patient alone to process the flashback. Option D. Remind the patient that the flashback is not real. The correct answer is option B. Help the patient reorient to the present. When a patient with PTSD is experiencing flashbacks, the most appropriate intervention is to help them reorient to the present. This intervention can assist in reducing the intensity of the flashback and providing a. Question 10. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A. Limited language skills. Option B. Level of cognitive development. Option C. Level of emotional development. Option D. Parental denial that a problem exists. The correct answer is option D. Parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 11. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A. Deep breathing exercises. Option B. Physical exercise. Option C. Mindfulness meditation. Option D. Journaling. The correct answer is option A. Deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the botus relaxation response, leading to. Question 12. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A. High-protein foods. Option B. High-fiber foods. Option C. Tyramine-rich foods. Option D. Low-fat foods. The correct answer is option C. Tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 13. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A. Shortness of breath, gastrointestinal distress, chronic cough. Option B. Ataxia, severe hypotension, large volume of dilute urine. Option C. Gastrointestinal distress, thirst, nystagmus. Option D. Electroencephalographic changes, chest pain, dizziness. The correct answer is option B. Ataxia, severe hypotension, large volume of dilute urine. The correct answer is B. Ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination. Severe hypotension indicates dangerously. Question 14. Which statement demonstrates a well-structured attempt at limit setting? Option A. Hitting me when you are angry is unacceptable. Option B. I expect you to behave yourself during dinner. Option C. Come here, right now. Option D. Good boys don't bite. The correct answer is option A. Hitting me when you are angry is unacceptable. Choice A. Hitting me when you are angry is unacceptable demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear. Question 15. What is the most appropriate intervention for a patient experiencing a panic attack? Option A. Encourage deep, slow breathing. Option B. Encourage the patient to talk about their feelings. Option C. Leave the patient alone to calm down. Option D. Engage the patient in a physical activity. The correct answer is option A. Encourage deep, slow breathing. Encouraging deep, slow breathing is the most appropriate intervention for a patient experiencing a panic attack. This technique can help the patient regulate their breathing, reduce hyperventilation, and promote. Question 16. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A. Hypotension. Option B. Sexual dysfunction. Option C. Increased appetite. Option D. Tachycardia. The correct answer is option B. Sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors, SSRIs. SSRIs can affect sexual function by causing issues such as decreased libido, delayed. Question 17. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 18. When explaining suicide precautions to a client, what would be the best explanation? Option A. You need to control yourself. If you cannot, we will do it for you. Option B. This can seem embarrassing, but we want you to be safe. Option C. You will stay on these precautions for 1 week. Option D. When you feel you are safer, then we will not need to observe you. The correct answer is option D. When you feel you are safer, then we will not need to observe you. Choice D provides a supportive and empowering explanation to the client on suicide precautions. It emphasizes the client's own sense of safety and control, indicating that the observation is temporary and can be. Question 19. A client is experiencing progressive changes in memory that have interfered with personal, social, and occupational functioning. The client exhibits poor judgment and has a short attention span. The nurse recognizes these as classic signs of which condition? Option A, delirium. Option B, mania. Option C, Parkinsonism. Option D, Alzheimer's. The correct answer is option D, Alzheimer's. The client's presentation of progressive memory changes, poor judgment, and attention deficits align with classic signs of Alzheimer's disease. Alzheimer's is a neurodegenerative disorder characterized by cognitive. Question 20. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 21. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A. Teach the patient relaxation techniques. Option B. Gradual exposure to feared situations. Option C. Encourage the patient to attend social gatherings. Option D. Provide education about the disorder. The correct answer is option B. Gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home, a common. Question 22. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A. Encourage the patient to talk about their feelings. Option B. Use a firm, authoritative approach. Option C. Stay with the patient and provide a quiet environment. Option D. Suggest the patient watch TV to distract themselves. The correct answer is option C. Stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support, encouraging the patient to talk. Question 23. A patient with obsessive-compulsive disorder, OCD, is performing a ritualistic handwashing routine. What is the nurse's best initial response? Option A. Interrupt the ritual to help the patient gain control. Option B. Allow the ritual but set limits on the duration. Option C. Ignore the behavior to avoid reinforcing it. Option D. Encourage the patient to stop the ritual and discuss their feelings. The correct answer is option B. Allow the ritual but set limits on the duration. In managing a patient with OCD engaging in ritualistic behaviors like handwashing, the nurse's best initial response is to allow the ritual but set limits on the duration. This approach helps in managing the behavior. Question 24. In assessing a patient for signs of serotonin syndrome, which of the following symptoms would be consistent with this condition? Option A. Hypotension, bradycardia, hypothermia. Option B. Hypertension, tachycardia, hyperthermia. Option C. Hypotension, tachycardia, hypothermia. Option D. Hypertension, bradycardia, hyperthermia. The correct answer is option B. Hypertension, tachycardia, hyperthermia. Serotonin syndrome is characterized by a triad of symptoms: hypertension, tachycardia, and hyperthermia. Therefore, the correct answer is B. Hypotension, bradycardia, and hypothermia. Choice A are not typical. Question 25. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A, restating. Option B, encouraging description of perception. Option C, summarizing. Option D, asking why questions. The correct answer is option D, asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication, as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot.